Thank you both so much for your time. We do appreciate it. I'm very glad 2 years later we have some restrictions that have been eased, but also our infection rate isn't as worrying. Professor Mosa Moshabela, maybe I can start with you. 2 years later, many criticised government for the drastic measures that they had to take, putting us under level 5 of lockdown. Would you say that this worked in us trying to fight this pandemic?
Yeah, greetings, Heidi. And the viewers. I think that, I think in hindsight, Heidi, we can say that it's possible that the level of lockdown that we went into at this time 2 years ago was quite harsh, and perhaps it could have been avoided. But today we are speaking from a place of a lot of privilege, in the sense that we've got high levels of immunity in the population, with nearly 50% of adults vaccinated. In many ways, a lot of people are aware of what they need to do to protect themselves. And a lot of science has been produced over the years, and it evolved and changed, and we've come a long way. But I think at the time, really, there was so much uncertainty. It was almost like being in the dark. And whether what was a right or a wrong decision was very difficult to tell. And in fact, South Africa then went for the sort of more kind of overcautious approach. And of course, we learned very quickly the negative effects of that. And our discourse in science quickly shifted to the negative impacts of lockdowns and so forth, before it went to sort of the biomedical interventions of clinical trials for vaccines and other things. And I think that, Heidi, for me, I think that in retrospect, yes, we know that, we could have avoided such strict measures, but I think we are here, we are comfortable in the place that we are at, in as much as we've had some, unintended and collateral damage and some losses. But on the whole, we are in a good place. And for me, I'm quite grateful. Even as we reflect, I look back with pride overall in terms of how collectively in South Africa, how far we've come.
Professor Martin, maybe we can bring you in here. I think many were very worried about our healthcare system and our hospitals, and whether or not they would be able to deal with the severity that COVID-19 brought, with people needing to be in ICU, on ventilators, oxygen. Speak to us about your experience over the last 2 years and how difficult it was.
So I think that, again, very relieved that we are where we are with this pandemic at the moment. But I think what we've been through over the last 2 years just reflects the challenge of a health system that's struggling, that has not got the kind of ability to react to uncertainty. So clearly, as Professor Mashabane said, there was a lot of uncertainty. Many of us thought that the severe lockdowns were probably correct, but it was based more on an emotional response more than any science. And what we recognize now is that it probably was not necessary. So there were some interesting outcomes that we certainly felt at Chris Hani Baragwanath Hospital. So the first one was the impact on trauma. And so during the first lockdown period, trauma, whether it was due to the banning of alcohol or whether it was due to the curfews, it's difficult to say, but certainly there was almost no trauma. And that was a remarkable situation and a remarkable experience in South Africa. I don't think in all the years that I've been practicing as a surgeon that we've ever experienced this kind of sustained reduction in trauma. So I think that was an important lesson. But have we reacted to that appropriately? Have we learned the lesson? What have we done to ensure that the lessons learned take us into the future, and that we as a society then can act in the prevention of trauma? I think the impact on the hospital was also interesting, because we realized very quickly that we couldn't continue to practice medicine as we always had, and that we needed to find a different way for our hospital to function. And it brought about the concept of interdisciplinary integration. And that was really an important lesson, where people who were not used to dealing with certain disease processes had to learn very quickly how to do that, so that we could all support what was going on in the hospital during those first few months. And also, as the different waves came, it became necessary to use those same lessons. So I think that there were some really important outcomes for us as health professionals in the public sector that we had to learn very quickly. But the one that disappoints me the most is that we don't seem to have learned the lessons around trauma and the reduction in alcohol consumption as a society.
Certainly, and I think that's definitely a discussion that we still need to have with regards to, we saw the kind of impact that a lockdown had, especially on trauma, gender-based violence, and perhaps we can take some lessons from that. But Professor Mosa, maybe we can come back to you. Many would say that some of the restrictions, especially in level 5, even level 4 up to level 3, for example, the curfew, the alcohol ban, and even the tobacco ban, many said that that did not actually provide the necessary impact or had the right kind of impact in stopping the spread of the virus. What is your take, for example, on the tobacco ban and the curfew?
Yeah, I mean, these are important times. At the time, I was quite actively involved in issues around tobacco. And given the evidence that was emerging at the time in terms of the potential risk of tobacco, we supported the sort of ban on tobacco, even though, of course, we were basically making a policy decision that did not have the evidence base, that didn't exist at the time. But even with alcohol, the strongest evidence we had eventually was really on the reduction on hospital beds and creating space and capacity in the health system. But not so much evidence has been linked to, reduction of the spread of infections. In South Africa, we don't have the strong evidence base on the things that have actually helped to prevent infections in terms of public health and social and behavioral interventions. We've got good data, of course, with the clinical trials that we've done on the biomedical interventions and vaccines in particular. But because we don't really have a strong discourse around social and behavioral science in South Africa, which we found to be a big gap at the time because we wanted to regulate the spread of infections with behavioral modification. But most of the time we will say, where are the behavioral scientists? And we don't have that. And for me, it's a big gap. And right now, I think that we still don't have the conclusive evidence in South Africa to say that many of those behavioral decisions and behavioral policies that we adopted have actually helped to curb the infections. We know globally that these behavioral and public health and social measures and behavioral measures were important in reducing transmission. We know that particularly when you combine them, when you've got a combination of interventions, that's where you get the maximum benefit. That's what people talk about, the cheese kind of model. But in South Africa, we don't have that strong base of evidence, Heidi.
Professor Martin, let's end off with you. I think there was a lot of strain on South Africans in general, but also healthcare workers, because there was a lot that we didn't know when this pandemic hit. It was very concerning. We didn't know how serious it would be if people did get infected, and also the issue around late procurement of vaccines. I'm sure as a surgeon and in the heart of things, that must have been quite concerning for you and quite brought about a lot of anxiety.
So I think the anxiety was widespread across all health professionals because I think there was a lot of fear in the unknown. A lot of people didn't know whether they were taking the disease home to their families and that they were putting their families at risk. And so not only was the anxiety and the pressure of having to work in this huge unknown. I think that when the vaccine started to become available, it first started with health professionals, and I definitely think it made a significant difference to the levels of anxiety that most of us were working with. From a purely surgical point of view, I think we're going to struggle for many years to overcome the backlog that the processes that we had to put in place to deal with the pandemic. And so surgeons are having to look quite seriously at resources, looking at access to operating theatres to try and understand how we can catch up. And I think that that impact on our patients, the fact that we know that patients continue to suffer, patients with things like cancer, may now be presenting with later stages of cancer, patients with other illnesses who didn't present as early as they could have are now presenting with more severe forms of the diseases. So I think that all of that still continues to be with us. And while vaccines and the reduction in the lockdown and all those restrictions may be important for individuals and for us as just ordinary members of communities, but I think as professionals, we still have a lot of anxiety. When's the next wave coming? How will that impact on us? What will the severity of that wave be? Will it be an Omicron? Will it be a Delta? So I think that as health professionals, we still continue to have many questions. And without the evidence, as Professor Moshabela talks about at many levels, I think the anxiety levels are reduced, there's no doubt. But I think that we've just had a very nice lull. We've just had a holiday, a COVID holiday. But now that we kind of think we're heading towards the next wave, again, I think the level of anxiety is building again, with the unknowns being too much for us to be able to have a clear approach. And the uncertainty makes it even more difficult now for the health system to reset itself, to reset in a period when you had this kind of uncertainty in the ability of the health system to do that, makes it even worse because we're not sure what we face. So again, I think that, let me repeat, the uncertainty is really one of the challenges that we all face and a source of a lot of anxiety.
Definitely. Thank you both so much for your time. We really do appreciate it. That's Professor Mosa Moshabela, Deputy Vice-Chancellor of the Research and Innovation at the University of KwaZulu-Natal, as well as Professor Martin Smith, who is a head of clinical surgery at Chris Hani Baragwanath Hospital.